The lateral hip, the gluteus minimus, the gluteus medius, the iliotibial band, and the greater trochanteric bursa are the main structures we're going to identify. Understand that the gluteus minimus inserts at the anterior facet of the greater trochanter. The gluteus medius has two insertions to the greater trochanter, slightly different locations. The anterior band of the glute med inserts to the lateral facet, and the posterior band of the glute med inserts to the superior posterior aspect of the greater trochanter. So, in addition, we're going to identify the peribursal fat layer of the trochanteric bursa, as well as the iliotibial band in its relationship to the greater trochanter and the gluteus minimus and medius tendons. To look at these trochanteric insertions of the med and minimus, gluteus medius and gluteus minimus tendons, I'm going to start distally, or more at the proximal third of the thigh of the femur, so we know where we're at, okay? So right here I'm looking at the femur and essentially what's cross-section. This muscle here is the vastus lateralis. I'm going to move superiorly. You're going to watch the lateralis get smaller and the femur start to change shapes. And I'm going to stop when I get to the area I want. So we see this apex here. Okay, so this little peak here, heard it called widow's peak, or I call it the apex. This is essentially home base. So anterior to that is where the gluteus minimus inserts, and lateral and posterior to that is where the medius inserts. So let's get more specific here. Okay, so here's our peak. I'm moving anteriorly, and we have a nice insertion of the anterior facet and the minimus tendon. I'm gonna give you a footprint width estimation of this insertion. So you look at the caliper. This is basically 1.63 centimeters. This is basically your footprint